chiropractor has portal of entry rights, meaning you can just go see them. So you as a fitness professional can't always refer to a physical therapist. You can refer to a chiropractor. Primary care physician, all right, that's when something's wrong, you don't know what's wrong. They're sick, they're not breathing very well, they're fatigued, they're discolored in some sort of way. Something's wrong, you don't know what's wrong, but something's wrong. Now, obviously, they can provide antibiotics, drugs, muscle relaxers, stuff like that. But a primary care comes into play where they're also a great secondary referral source. So what I mean by that is, I don't know where they should go. Send them to the primary care. The primary care is able to say, oh, you need to go to a neurologist, you need to go to a gastroenterologist, you need to go to a cardiologist, whatever that is. So that's what a primary care is great with that sort of thing. Orthopedic doctor. Right? Orthopedic doctor is the same sort of thing as chiropractic, physical therapist. My shoulder hurts, my knee hurts, my elbow hurts. The stuff, you'll be dealing with that sort of thing a lot, okay? Now, a chiropractor and a physical therapist, that's conservative care. What do I mean by conservative care? They don't do drugs, they don't do surgery. They do mainly like manual therapy and exercises and stuff like that. The orthopedic doctor is, the tools in their belt are injections, steroids, different medications, surgery, and then a lot of times they refer to physical therapists as well. So that's what you're going to get. So you'll want to know, does your client want conservative care? Or do they want non-conservative care, kind of like traditional medical care, meaning orthopedic? Okay, so that's a conversation to have. Podiatrist. The podiatrist is the orthopedic doctor of the foot. Okay, if they've got a nasty bunion or broken foot or fallen arch or something along those lines, a podiatrist is a great person to refer to. Nutritionist. Now, as you trainer types and gym owners and stuff like that, more entrepreneurial people will get out there, you might want to handle nutrition. Okay? Nutrition is a great way to be able to supplement your income and diversify your offerings to your clients. But for those of you that don't, you'll want a nutritionist, so you can send them over to them and get their diet in order. Alternative medicine. Who's gone to acupuncturist? Nobody? Okay. Who's gone to a doctor of Oriental medicine? Who's gone to a massage therapist? Okay, massage therapy. Yeah, I haven't gone to the first two either, so I'm not a great expert of those. But I do like them because they don't use drugs and surgery, so I have referred to both of those. Massage therapist, that's pretty popular, okay? People are going to come to you, oh, my shoulder hurts, I just feel like it needs a good rub. You have a good massage therapist? Absolutely. So those are a lot of the people you're going to refer to. Is anybody out here in the, graduated from school and in the professional world yet? Yeah? Have you referred to anybody other than who's on this list? No?
Maybe as a trainer, mental health.
Mental health, that's a great one. I didn't touch on that. You'll definitely want a good therapist or psychologist or psychiatrist on your list. That's a good point. Any others? Right. Any healthcare professionals that you guys have gone to that aren't on this list that have been helpful to you? Now, this is a pretty darn healthy, young population we have here, but nevertheless, is there anybody that you can think of to be on your network that I haven't touched on yet?
Well, not me, but my dad, he went to see someone about foot cricket. I don't know.
Yeah.
I don't even know what it's called, but it actually worked for him.
Yeah.
The nerve underneath the foot.
Sure. So I don't know, it could be acupuncture, it could be acupressure, whatever the heck it is. If it works, keep that in mind, okay? So that's great. Now, quiz time for you guys. Your client has knee pain. Who are you going to refer them to? Chiropractor? Nah, he likes, I like him. He's talking, that's good. What if, I don't like chiropractors. PT, good. I just want something more like legitimate.
Orthopedic.
Orthopedic, perfectly. And I don't like All right, perfect. That's exactly it. That's your thought process. I don't like a chiropractor? Fine. You don't have to go to a chiropractor. Who else would you agree to that can help serve you? All right? How? All right, that's next. Now this is the conversation you're going to have with the client. Some people are uncomfortable with this conversation, but if you're going to develop that network that really supports your client and really supports you, you're going to want to get good at this conversation. So the first thing you want to do is you want to find that there's agreement that there's a problem here and we should take an action. So, what's your name? Kathleen. Kathleen, tell me you're a client, you have a problem.
Any problem?
Yeah, tell me about your problem.
I can't do push-ups because it hurts.
You can't do push-ups because it hurts your wrist. That sucks. We've been dealing with that for a few weeks too. Well, do you want to do something about that? Yeah? Because I got a good guy I can send you to. He's really good. Do you want his contact information? Definitely? Okay, good. His name's Scott Hoar. He's a chiropractor. Okay? I know he's got a goofy last name, but don't worry about that. Do you want me to have Scott contact you?
Sure.
Okay, perfect. Now that's the ideal conversation because she's saying everything she thinks I want her to say, which I appreciate. But, you want agreement. Hey client, do you want to do something about this? Because sometimes they're just whining. As a trainer, you guys hear more whining than, well, I hear a lot of whining too, but you hear a lot of whining from your clients. My wrist hurts when I do push-ups. Okay, great. You want me to send you to like a professional that you think you can help you out with that? No. Okay. No big deal. Fine. Now if they keep whining about it, you can stay in their ear a little bit more and say, we can do something about it. I can send you to a professional. But I made a great handout that gives you kind of like the conversation starters to a lot of these conversations that you're going to need to have with people regarding creating your network, like talking to the healthcare professional, talking to the client, talking to the secretary of the healthcare professional that you're trying to actually get into the door of. All right? And I created this handout, but we weren't able to get it printed out. So I have that available to me. So if you want to email me, all of you have my card at this point. I'd be happy to send you that handout. I think that's an awesome handout. Like it took me years to be able to do this stuff that's on this handout. I mean, if you want to connect with an orthopedic doctor, what are you going to do? What would your first step be? Going to see one? As a patient?
Possibly.
All right. What would that look like? How would you do that?
I would contact whoever they contact and research, see one in the area.
Right.
Reviews.
Yeah, absolutely. That's perfect. You would call up the secretary once you decide on who it is, and you say, I want to meet with Dr. So-and-so. You know what they're going to say to you? I'm sorry, are you a patient? And then you're going to say no. And they're like, I'm sorry, he's busy right now. And that's the way it is. And then suddenly you're like, I can't believe I'm nervous about this. This is like a conversation. Like, what am I even going to say? So the handout's really great because it gives you some pointers as to how can you open some doors and get people to actually decide, you know what, I do want help and help you grow your network of professionals. All right? One thing I do want to point out is that in serving your customers, all right, your clients, the people you deal with, offering to have them contact you is a big thing, okay? Because as a client, if you don't have to lift a finger, if you don't have to look them up in the phone book and make your own call, it makes your life a whole lot easier, okay? So you say, you know what? I'm going to get you that orthopedic doctor's number. You want me to have an orthopedic doctor call you? Yeah, sure, sounds good, right? So that's something you should do. You should have the contact information of the people on your network readily available, be able to contact them and have them get in contact with your clients, all right? That's important, okay, to making these connections actually happen. I've got wonderful source of mine. He's a health coach / nutritionist trainer type. You know, kind of a independent entrepreneur type, but he does all these things, right? And the way it looks is, we'll just call him James for the example's sake. Okay, so James has a client, he's training him privately, and James is having hip pain. And this has been a chronic problem, and they've been dealing with this for a while now. So James says to his client, hey, I've got a great guy that could help you out with that hip pain. Do you want me to have him contact you? The client, Bob, we'll call him. Bob says, yeah, that'd be great. So Bob comes in to see me. I treat him, I do my little chiropractic process, and his hip is feeling a lot better. And then James, the trainer, texts me, and he goes, hey, how did it go with Bob? I say, oh, it went really well. And then James says, is there anything you want me to do during the training sessions, or is there anything you'd like me to avoid during my training sessions? And I reply, absolutely. Concentrate on posterior chain flexibility and hold off on lunges until they're pain-free. So me and James are working together to make sure Bob gets better service, okay? James got to hold on to his client. I got a client. Both of us got paid, okay? And Bob got served and is happy with all parties involved. Okay, that's the way it looks when it's working the way we want it to. Okay? So, what I want to do right now is, in a second, I'm going to kind of show you an example chiropractic treatment real quick, just so you have a picture in your head of what that would actually look like. But right now, what I'd like you to do is to actually partner up, one-on-one, pick an A and pick a B, and I would like it if you guys can have that client-trainer conversation. Okay? The client is going to say, gosh, my shoulder hurts, or my toe hurts, stuff like that. And you as a trainer are going to say, oh, should we do something about that? And then the client's going to say yes or no, and then you're going to offer the services and actually have that conversation. Okay? Is there anybody that's like, does that sound like not like a comfortable thing to do? Not, I would be nervous to have that conversation with my client, anything like that? No? Bunch of brave souls in here. Good.
Yeah, I guess kind of, because like, I feel like some people might think that you're trying to sell them.
You're trying to sell them. Would anybody be uncomfortable about the idea of trying to sell your clients, that you're paying clients that are already happy with you?
With certain clients.
With certain
I feel like
clients.
it's more clients. Some clients would be more receptive to it than other ones are not.
Right. Absolutely. And how do you differentiate between those two without ruffling any feathers from them? How would you do that?
I'm not sure. I think the biggest thing is like the trust between, but I feel like a lot of times the issues I see with form or injury occur very early in the training.
Mm-hmm.
So before that's built.
Sure. Yeah, absolutely. You guys are developing trust with your clients, and maybe you don't have it yet, and you see an injury that's kind of inhibiting your progress as a trainer. That makes sense. That will come up. The only thing you can do is say, hey, client, I notice you have shoulder pain. I think it would really benefit from a therapist. Do you want to explore that? Do you want me to put him in contact with you? Do you want to contact him? Do you want his contact information? And now say no. Say no. Okay. So that's an example of somebody that is not receptive to it, right? Did I ruffle your feathers? Do you feel like I was pushy? Do you feel like anything like that? No. If you hear no, that's fine. No big deal. If you want me to help you, I'll help you. Don't get defensive. Don't get annoyed. Don't make them wrong. Like, oh, come on, idiot. I can't freaking make you do squats when your knee hurts. Go have it fixed. You know, that's not the greatest thing to do. But, okay, good. So turn to your partner and have those conversations.